Hi, welcome back to CPAC. And I am here on the Lawyer Dana show with John Spagnola. I do it? Okay. He is the president of the Veteran Strategic Solutions, and he has a lot to tell us about what's going on with our veterans right now. So I'm going to let John take it away.
Thank you so much.
Yes.
And thanks for the invitation.
Yes.
Yeah, when it comes to veterans, I mean, obviously they're near and dear to all of us. The
Right.
reason we're here, we have freedom,
Absolutely.
rights that we have, so we owe them a lot. And, for the last 10 to 20 years, uh, the suicide rates have really much maintained. They have not gone down. If anything, they've gone up.
Oh, okay.
And so the situation is that I've dug into that
Mhm.
because it's a concern. And what I realized is that if you talk to a veteran, and I urge you to do so, ask them if they're on medications or have been on medications. You know, do they know the side effects of those medications?
That's really interesting that you're bringing this up because, depression is high in our military and, what they go through. As a civilian, someone who's never been in the military, my father in law fought in Vietnam and he went through a lot of stuff. And, it's post traumatic syndrome, right?
Yeah.
And, and knowing that all that they go through and then they're put on medication to help them. But you were informing me earlier, this medication, the number one risk is suicide.
That's what
And
people don't realize is that the first side effect, actually listed by the FDA, is suicide ideation. And just think of it. If you're a veteran, there's two scenarios here. If you're a veteran and no one told you that,
right.
right? And suddenly you start feeling a bit suicidal, or maybe you have severe depression, and you can't figure, and you start thinking, you know, maybe you just lost your job,
Right.
maybe your wife left you, or a husband left you, what have you, and you start going, well, life is really not worth living.
Right.
I'm broken. And why am I sticking around being a burden? Because these guys are really proud.
Mhm.
They're loyal. They're really good people. And so they don't want to be a burden to anyone. And if you don't realize that the suicide thoughts might be coming from the medications,
Right.
right? You'll think you're broken and maybe you won't want to stick around, or you'll take some drastic action.
That
Right?
is so sad.
Second scenario,
Uh
the
huh.
doctor tells you, by the way, if you feel suicidal, homicide, here's another side effect, depressed, anxious, can't sleep, could be coming from the medication. Instead of taking drastic action, you might go, hey, the doctor said this, I could be feeling like this.
Right.
See? So
Right.
it could be very preventative. So as a result of that, we find that when doctors deal with you,
Mhm.
they're giving you what they call verbal consent, which
Mhm.
means they tell you this verbally, but how do you monitor and how do you enforce verbal consent? You can't.
Right.
So what we're advocating right now, and I have the support of 12 or 13 veteran service organizations, is what they call written informed consent.
Okay. That's great.
It's really a simple implementation. The doctor would get you to sign a form, and that form says, I've been told the side effects, and I've been told the treatment options,
Right.
right? And treatment options can include chiropractic, acupuncture, canine therapy.
Well,
I,
I noticed something, even
sure.
at the pharmacies, you know, usually when you get a medication, the pharmacist would come over and ask you, have you ever taken this medication?
Yes.
And do you know the risks or the side effects behind the medication? I notice nowadays they don't even do that anymore unless you request it. And so, there's another problem that might be, occurring as well is pharmacies get so busy. And so the pharmacists aren't having the time to like actually educate somebody to make sure they understand how the medicine works.
Yes.
And so that's another thing that could help as well.
That's a An excellent point. I mean, by the time a pharmacy gets to a person, diagnosis.
Hmm.
See, and it's the doctor's job to provide him informed consent.
Right.
So if you have to wait till the pharmacy, that's a little further down the road than it should be.
Right.
So we're advocating the doctors provide written consent. Um, and there's another aspect that's equally as important, and it's called the differential diagnosis. And it's real simple, although it's a complex term.
Right.
For a long period of time, doctors were applying a differential diagnosis, and that means you eliminate every potential cause of that situation before you provide the diagnosis. And the
Okay.
reason that's real important, people don't realize it, but hormone imbalance
Right.
can cause depression, anxiety, suicidal thoughts,
Absolutely.
hallucinations, you name it.
Absolutely.
Right. Nutritional deficiencies.
Vitamin D.
There you go. Yeah.
Yes. If you're low on vitamin D, it can make you have like dementia.
Yes. Yeah,
A lot of
look,
people don't
it
realize
is
that.
the most important vitamin you can take.
Absolutely.
Right.
Absolutely.
And B, for your thinking and
Uh-huh.
brightness and so on. And C, the body doesn't make it, and it's
Yeah.
a major antitoxin.
Right.
And it's just very healthy.
And another thing a lot of people don't realize is your gut health has a lot to do with your overall health.
Yes.
And so, what's going on in your stomach affects every part of your body. So it's interesting. I do a lot of research on this
I'm
stuff.
glad you do.
Unfortunately, my mother has Alzheimer's, so it made me really like dig deep into what causes these things, because I do think that Alzheimer's dementia can be prevented
Yes.
if we. And so it's really interesting the stuff I've actually learned from it. But
And the gut health you're talking
yeah.
about, people don't realize you're right. That's where like 80%, of the positive bacteria in your body is.
Right.
And you need that
Right.
to function
Right.
and to have a healthy brain, healthy heart, and so on. Right?
Absolutely.
So a differential diagnosis, if we could test for, instead of just drugging the person, because you might be drugged, people go, oh, pain needs to be drugged.
Right.
Anxiety needs to get drugged. I'm not saying it doesn't if it's short term,
Right.
but those are flags. Those are red flags that say, hey, there's a problem.
Exactly.
And now you're supposed to test and eliminate all the potential causes like nutrition,
Right.
hormones, chemical toxins,
Mhm.
to ensure that you've got the source of the problem.
Right.
Because
Absolutely.
whether it's you or a veteran,
Right.
you want the source treated.
Exactly. Absolutely.
And right now in our society, it's knee jerk to treat the symptoms.
Right.
Those red flags, they're treating and they're trying to hide them. No, you don't want to hide those. You want to use those to dig into the real problem.
Right. No, I 100% agree. Listen, if you're not looking at your veterans and your society, please do. Please try to help support them. Please try to help them. If someone comes to you that's a veteran that's suffering through depression, be somebody that is listening to them, because that's what they need. They need to be heard out and try to help them. And thank you, John, for coming on. And thank you for all you're doing.
Thank you. I wanted to just mention my website just in case
yes, go right
someone
ahead.
might want to get more information.
Absolutely.
It's Veterans, plural, Veterans Strategic Solutions. And I also wanted to mention I'm in touch with RFK Jr., who is in touch with me personally.
Awesome.
And is very supportive.
That is amazing.
Isn't that nice?
I'm excited for what all he's going to bring.
I am too. He's such a breath of fresh air.
I mean, it's something we need so badly. So
I agree.
So Veterans Strategic Solutions.
Yes.
.com.
Exactly.
Please go check out John's website. And thank you so much for tuning in. And we're excited to hear what all that he's going to do with RFK. So thank you.
Thanks again.
Thanks, John.
My pleasure.